So, a very good afternoon to all of you, and my name is Richa Tyagi. On behalf of Miracle Foundation India, I welcome you to this webinar on safe and permanent child reintegration. So, what an enthusiastic response we have. We got over 100 registrations, and this webinar is being streamed live on Facebook right now. And if any person in your network still want to join, they can very well join on Facebook Live. Can we put the link in the chat, please, for the participants? Okay, so as participants are joining in, let us begin with a short video. It's a 1-minute video, which really, it's called Impossible, which highlights the vision of Miracle Foundation for an orphan-free world in its lifetime.
That's the word people use before something amazing happens, before the world changes, and nothing is ever the same. At Miracle Foundation, we know all about impossible. Every day, we fight for more than 8 million children living in institutions, working hard to reunify families, one child at a time. It's a huge job with an outrageous goal, an orphan-free world in our lifetime. Impossible? Every great movement begins with impossible. They just need to end with a miracle.
Thank you for the video. So really, I find it to be a very powerful video, which really tells us how the whole issue, the whole subject of children without parental care, which has been a matter of concern. And when we are talking about the subject of reintegration and family for children, which seems to be quite impossible, as the video says, it's quite a huge task with an outrageous goal. But I believe that all of us together here, when we work with a child-centric collaborative approach, we can make it happen. So it seems like a impossible move. Every movement begins with that notion of impossible. But let us come together and really make it seem that this is achievable, and it then will look like a miracle. So, yeah, once again, welcome all the other participants who have joined in to the webinar today. And as we set into this webinar, we look at the whole purpose of it. The whole subject of transformation of care seems to be quite a complex subject to us. And there is a huge discourse about family-based care around the country, around the world. And it is rooted in the principle of suitability, principle of necessity of the care options and the best interest of child. Today's webinar is really about helping us to further build our knowledge and season up our understanding on this whole subject of reintegration and look at it in a very holistic way. Where we really look at the whole purview of the voice of children, their participation in this process, the whole assessment and preparation of the families and children towards successful reintegration. Most importantly, we also dwell on the convergence of resources and services, which are so important for this support to the families in their strengthening, and about the preparedness of our state, about our government and our authorities towards making and providing this sustainable support to the families and the children. So this is really the purview of our today's webinar. And as we get into the ground rules, let us set the ground rules at the outset. So basically, this webinar is being recorded. The recordings will be shared with you after the webinar, but we'll request you to also spread this in your network. A very important part of this webinar is going to be the question and answer session, the discussion. So we request all the participants to put forward your questions as we go along in the webinar in the question and answer box, which you will see at the bottom of your screen, just adjacent to the chat box. And also, towards the end of the webinar, we will have a feedback survey. We will request you to take this survey, which is going to be very, very important for us. And once again, as I said, this webinar is being streamed live on Facebook Live. So if others want to join, they can very well join in by logging into the link which has been provided in the chat box. Now, as we begin, we would like to know from our participants as to what is it that they're looking forward to learn and understand from this webinar. So let's do a poll, and we are going to use Mentimeter here. Some of you may know about it. Those of you who don't know about it, this is very simple tool. You just have to go into your browser, click on menti.com, and you will see you will once you click on it, you will have to enter a passcode there, sorry, which you will see, which will show you on the screen. So here, can we put the passcode in the chat box also for the participants? And as soon as you put the code there, you will see this question: through this webinar, I'm looking forward to learning or understanding. So you can put your points there. As you do it, you will see this on the screen. Okay, so we are getting the responses on the screen to connect with new people about child reintegration, about sustainable and safe placement, learning about children behavior, the problems on reintegrating children to families, effective reintegration. All right. We have understanding why there is a need for CCI and why a child needs to leave the family. Okay. Any more responses coming in? Okay. I think that's the purview of that helps us. So thank you so much. And as we move ahead, we have esteemed panel today with us. Very excited to have all of you with us. And this is my privilege to introduce you now. We have with us Ms. Sharmila Ray. She is the Child Protection Specialist with UNICEF in Gujarat, has been working with UNICEF since 2017, closely working with the government and civil society on various issues of children like child labor, child marriage, children in institutions, and so on. So welcome, Sharmila, to the panel. We have with us Mr. Prabhat Kumar from Save the Children, Deputy Director, Child Protection, has over 18 years of experience in child rights in various roles, leading Save the Children's programs across the country. Has been working closely with the government and the civil society, particularly in the area of policy making for children. So welcome, Prabhat, to the panel. We have with us Ms. Geetanjali. She is the District Child Protection Officer from Malappuram district in Kerala. She has extensive 8 years experience in child rights, has also served as Child Development Project Officer with the Department of WCD for 2 years, and has also served as a guest faculty with the Kerala Institute of Local Administration. So welcome, Geetanjali, to the panel. We have with us Mr. Isaac Arulappan, who is the founder of Devakirubai Social Help Association, DKSHA, in Malappuram in Tiruchirappalli district. He's also the founder of Cornerstone, having experienced life in a CCI himself. He was really committed to give back to the children and the women to improve their lives. And he is also a Rotarian, and he is a featured guest in many international Rotary clubs. So welcome, Isaac. So glad to have you with us. We have with us Sandhya Mishra, who is heading as director programs in Miracle Foundation India. Sandhya is the second employee of Miracle Foundation India, and she also represents the organization on various platforms with the government and experts. But most importantly, she has been a national trainer in life skills education and in the area of child protection, child care, and development. So, welcome, Sandhya, to the panel. Yeah, so now as we go ahead, panelists, I just wanted to share with you that we'll begin this panel discussion with a video from one of our youth ambassador. So actually, we had thought to have, so we have Miracle has a program called Child Participation and Youth Ambassador Program, and we wanted one of our youth ambassador to also be on the panel. That could not happen, but we've managed to get a video. So we will begin with this video first from the youth ambassador, where we really get to understand the perspective and the concept which she's talking about from family-based care, reintegration and family strengthening.
Hi, I am Maria Sahuntala. I am pursuing Master of Social Work in Tamil Nadu and I am a youth ambassador. I am proud to be a youth ambassador because I am happy for get this opportunity. I will make as much changes I can in this society as a youth ambassador, and also I will encourage others as well. Family-based care is a child first right according to child right. Family and social relationship is most important for the child. When a child grows up from home, CCI, the individual attentions cannot be given to that child as much. So love and care will be fully available when the child grows up with the parents and struggling to get income and the value of relationship. When all of this available, the child is likely to be in a good health in the future. When a child grown up in the CCA, everyone will be raised equally. And the relationship will help to be healthy and good mental health in the future while grow up from home. The family mental health and economics should be strengthened during the reintegration process. It has 5 well-being domain there. First one is family and social relationship, household, economy, living conditions, health and mental health. In this, have to find what their needs. This is family strengthen process. So if you are going to do reintegration process, we must first know that the child thoughts as a family conditions. The child needs like life skill educations for face the challenges in the society. After the reintegration process, we have to must follow up the child. From this will be helpful to know about their safety and mental health and health care. Family is the most important influence in a child life. The children depend on parents and family to protect them and provide for their needs. They are a child first teachers and act as a role models to how to experience the world around them. Parents and family form a child first relationships. Families are important because human beings can't live solitary lives all the time, and they love and understand the children, helps to raise a child, and they help to make you who you are. So hence I think that every child should grow in a loving family. Thank you.
So that was Maria Shakuntala from the Youth Ambassador Program, giving us a perspective of how she looks at. So turning myself to the panelists, so I'll just quickly give you a snapshot of how we'll go about this session. This will be the first round will be where I will pose a primary question to each one of you. We will follow the sequence. I'll begin with Sandhya, followed by Isaac, then Prabhat, and then going to Gitanjali and Sharmila. I will request you that, if you could respond to this question, whether you're using slides or talking about it, keeping yourself to 5 to 6 minutes for that matter. Also, I have been given the charge of a timekeeper. So please allow me to come in and disturb you in case if you are exceeding that 6-minute time in the interest of the webinar, and because we want to also have other rounds of question and answers coming in. So that will be the case. So I'll begin with Sandhya. So Sandhya, I just wanted to understand that Miracle, having this experience of working with this approach of child first and child centric approach, has developed the whole process and tools towards reintegration and towards family placement. We really wanted you to give us a perspective, give us a kind of an overview of this whole sphere of reintegration at Miracle, particularly if you could dwell on how the tools and the processes that that are being developed are really bringing out that strength based approach, and also helping us or further looking at the approach of identification and redistribution of resources. Yeah.
Thank you. Thank you so much, Richa. Can I have slide? Yeah. So, good afternoon, friends. Today I'm going to share, next slide, please. I'm going to share about an overview of reintegration process and the case management tool, a little bit about case management tool and technique with all of you. Next slide. With this two initiative of Miracle Foundation, preventing children from entering the system in the first place and ensure that every child thrives, we are supporting orphans and vulnerable children to have better quality of life. Next slide. We have our reach in 18 states of India and working with CCIs, NGOs, UNICEF, state governments, especially with these two initiatives. And today, some of the findings I'm going to share with you from our program called Base Model. So, yeah, the important point of principle of case, what Richa asked question about the principle of transformation of care is about do no harm children. This is the first thing. It is not about that we have to also ensure their their rights and listen to children, because this will benefit us along with children. Always put families, biological families first. Try to reunite children with their biological families and create a range of service which is alternative to institution service, which is flexible, responsive, tailor-made for their unique need of families and children. And prioritize the most vulnerable, especially babies and children with disability first, if possible, because we need enough time for their placement. At the same time, work with other cases. It is very important for us to have effective use of resources because community resources are cheaper than institutional services, which most majority of children can utilize. So we need to have institutional services available for some complex need of children. Um, and we have all over the world, we have dedicated and skilled social worker, NGO worker, government worker working in this area, like working with the children and families in with their different areas. So we need to include them in transforming care. So better not to build a new thing rather than I mean, there should not be a parallel system. We should work with the existing services and system, and the most important is political will, and India is progressing towards that. And no care transformation is possible without any consultation with your district authority, with your state. So these are the something which I want to share. Next slide, please. When we say case management, it is very important that it is a transforming lives through individualized care and services. And the goal is not about numbers. We should not count that so many children have been reunified. We should count the developmental indicators of children when they're back to families. That is most important thing about the case management. Um, and the purpose is always consistent. It should be ongoing, and documentation and record keeping are something very, very important for case management processes. And engagement on family, children, protect so that there should not be any harm to them and their best interest of the children. So Miracle Foundation, with the years of experiences on the ground, we developed case management toolkit, which is available on our website. And this is completely based on strength based approach of child, family, and community. So that is very important for us to understand, value the family and the community and the children, their desire and their perception. Um, Next slide, please. So when we talk about case management, that processes, it has two situation. One situation, circumstances, goal is always reintegration and family-based alternative care. The situation we have when the child is in CCI or already reunified with the family, which comes under standard case management process. The second situation where we have emergency situation like flood, uh, pandemics like COVID, where we have an expedite case management. Next slide, please. This is a flow chart of case management. I'm not going into too much detail because everything is available on website and you can connect with us for more details. The important point I wanted to make here in this slide, that this is a principle of JJ Act, on the provision of JJ Act 2015, where it is important the moment child comes into the CCI, the JJ system, from the same day the reunification, the case management process starts. So that is very important for us to understand, that the ultimate aim is the child should be reintegrated in the society, because CCI is not the destination for the child. It's the alternative care, the last resort. That is why proper family and child assessment planning involve family and children in their planning and transition, and then implement the processes where the children will be placed in the family. And the most important point is follow up and evaluation. We should not leave the children the moment children go back to the society and the family. We should have a proper follow up and evaluation with them. Yeah, next slide, please. When it comes to expedite case management, the principle is same, no harm. All the principle will follow in case management. Only the sequence have been changed, which we have also witnessed during the COVID time, because the assessment of children and family and the planning and preparation happens when the child is already back to the family. So that is why we have these 4 steps, where we talk about prioritizing children, assess their safety, which we used Hope and Home's risk of children tool. Then Home Thrive Scale, which Miracle has this tool to identify the need, and according to that need, plan their intervention. And then the final recommendation in consultation with CWC. So that is an important process of expedite case management. One thing which I would like to share, and about the JJ form and JJ form 22, individual care plan and social investigation report, family assessment and child assessment, where we have added few addendums, guidelines, which has been used by child care workers, government official, and it has been widely appreciated, because the more you know about the child, the more better informed decision you can take about their placement. Um, Next slide, please. It is very important about the child safety. So we can, identify, determine the potential risk through these assessment, whether parental risk, family risk, environmental risk, or any other child risk factor through these assessment. Next slide. This is a Home Thrive Scale tool, which is we have on 5 well-being domain, which Shakuntala very nicely given, all 5 well-being domain: family, living condition, household economy, mental and social health, and education. So we score these 5 well-being domain in score of 1 to 4, and accordingly we identify their intervention plan. It is available on the paper. It is also available in the digitized form, because Miracle leverages technology as far as possible, which can be used by the ground worker also. It is not only the people sitting in the office. So that is what, and in future we are going to have little more simplified tools and processes. Um, and the Thrive scale, which you can see in your screen, previous slide, the Thrive scale you can see in your screen, the last one, which way you can take a follow-up of the monitor of the progress of the family or a group of family, where you can identify the what is the common needs in that area. That also will give you idea. Next slide, please. I would like to share some of the initiative what we have. We have two pilot projects for effective implementation of family-based care in Maharashtra, Ratnagiri, and Madhya Pradesh, Indore. We have a strategic review to identify services needed for children, like reason for admission and planning their future intervention. In under expedite case management, we have 51% children we have identified for permanent placement. Out of that, 79 children are already formally placed. Capacity building of government official on ECM on Gujarat, Jharkhand, and Bihar, and with other childcare workers also. And also case management, through case management tool, we are able to identify 113 family with the different linkages and social protection scheme. At the same time, we build capacity of child care workers in institution to provide psychosocial support, life skill education, career counseling when the children are in the CCIs, and also children in the family. And one thing which, we have a steering committee where the childcare institution, UNICEF, and the district authority, they are part of that steering committee. So now having more sense of ownership from the CCI and the district. So that this pilot program is not miracle pilot program. This is a district pilot program. Next slide, please. The learning what we have in the entire process is collaboration is the key. Without collaborating, it's not possible for a one organization to work in this area. That is what we said. And though the process is still slow, why and how takes time, have patience, but continuously working with the team, with the government official, with the CCI, with everyone. A mindset shift for parents also very important, because they also need to understand that why family based care process is important, and bandwidth of CCI staff. And also we had a lot of difficulties in connecting with the family through remote assessment and reaching family. That is why we utilize the resources of ASHA worker, Anganwadi workers wherever possible, and funds to be allocated for children. So money should follow children. Children should not follow money. And we have some state which have, set a wonderful example. When the children gone back to the family and society, they immediately supported family for that. So this is very important message to everyone, that funds is needed. Then next slide, please. The way forward we have is advocacy at every level. Utilize technology, participate in multiple forums. Miracle Foundation India is part of India Alternative Care Network. And we also try to best practices, share best practices with everyone, like this webinar, and more webinars will happen in future. Will ensure that India will have well-trained workforce. We are going to reach out to most of the states for the capacity building program. Still we are doing, but more will come in future. Train community leaders. We are very much ready to launch more prevention projects through family strengthening and community-led child protection mechanism. So that community should take care of their children rather than a third parties like us. Next slide, please. It's a very recent data came that almost 64% of children have gone back to the family since April, when the Supreme Court order has come. So it is the need of the hour to have a case management process in place, so that children and family, they are well supported, and most of the states are taking care of that. They are doing wonderful work in sponsorship and foster care. For their also case management processes, regular monitoring is very important. So please write to us, please email on this email ID, go to our website. You can go to India Alternative Care website also. So thank you so very much.
Thank you.
Floor
Thank you,
is open for
Sandhya.
question. Yeah.
Yeah, so thank you so much, Sandhya, for giving us this purview. And what really has, stayed with me here is when you said that it is the development indicators of the child. How is the child and family thriving when the child goes back to the family, and more than the numbers. And also, when you spoke about the strength-based approach of the child, family, and community, which you've mentioned about the community, the case management toolkit. So really the whole purview of the process, the tools that Miracle is using. And I would like to now go to Isaac. Isaac, it has been a privilege for Miracle Foundation to be working with Cornerstone for so many years, and where together towards this vision of a reintegration and a family for children, where we are working, where you're actually applying those tools and processes and approaches which Sandhya just spoke about. So I would request if you could give us a practical insight on how it actually works on the ground. When you're working or when you're actually applying these processes, these approaches of case management tools, working with the children and families. And I would particularly be interested to know what kind of mindset shifts and you are seeing in the family, and what kind of challenges you see there. So if you could give us that insight, that will be good. You're on mute.
Sorry, thank you. Actually, our institution, Devakrubai Social Help Association, called as Diksha, was established in 1993 to empower the lives of orphan and vulnerable children, widows and marginalized poor farmers. Since then, Diksha has been doing committed work for meeting life, health, social and educational needs of the poor through developmental projects and charitable activities. In the year 2004, Diksha, with 4 children, started a home for orphan and vulnerable children by name Cornerstone to respect children's rights and promote their survival, growth, and well being. The number of children increased in 2018 to 82 children, both boys and girls. Cornerstone has been reunifying children with families and continue to provide need-based support even after the reintegration for children who are 18 plus years. Since the organization has adopted the family-based alternative care approach, we try structure the unifications, post-reunification support, and monitoring throughout the process, which is aligned with Justice and Juvenile (JJ) Act. In 2018, our home stopped taking children into CCI, but concentrated more on family strengthening process with the suggestions of Miracle, our supporting organization. With our learning from Miracle team about permanent child reintegration, we started to give orientations and discussions with staff, all parents, legal guardians, and of course children, as we wanted to know their interests. Initially, there were many challenges. Even we ourselves could not understand. We could not convince the parents and legal guardians, especially the DCPU, District Child Protection Unit, and CWC on the family-based care strategy. But slowly, through engagements and our regular meetings, details shared at the time, Cornerstone hold home management committee meetings, we managed to build good understanding and working relations with DCPU and CWC Tiruchirappalli, Tamil Nadu state. There are village child protection committees, self-help groups, farmers clubs, and other structures in the community. However, there is still a need to escalate the importance of child protection issue at community level. Cornerstone has been working in the community for over the years. We understand the community structures and now are working towards activating community's role in ensuring the safety and well-being of children by strengthening families through coordination of service. Dedicated staff for networking and community engagement is a challenge. The structures have not felt child protection as an issue to be discussed at community level. So challenge is to be established as a common language through which we can spread the message of child rights, child protection, and prevention of family separations. Now, as a plan, we have included remote training on life skill education for the children who are temporarily placed in families due to COVID-19. This is actually a stepping stone to discuss about child rights and child protection with the larger audience, that is families. We understand now that families are also one of the entry point to activate community engagement for sustainable permanent reintegration of children in the families. Our sincere thanks to Miracle Foundation that has been working with Cornerstone, giving financial assistance, training for staff, and organizational development, mentoring support, follow-up, and studying the process made by Cornerstone with the help of the Thrive scale on the 14 standards of care to ensure the 12 rights of a child. Miracle team also extended best support, providing orientation to our staff on the process, trainings on assessments, preparation of children and families, providing follow-up support and monitoring the process through documentation. Preparation of families and children are not very easy. Preparation time varies from child to child, case to case. Definitely, it will take about 8 months as confirmation of decisions of the parents and children to be ensured at every stage of the process. Families also struggling to thrive through the years. New situations may have emerged which forces the parents not to take responsibilities of the children. For example, remarriage, migration, widowhood, and loss of livelihood, etc. Since we have almost 21 placements done during the pandemic time, the staff took extra efforts in integrating with the parents and children through remotely. This method has a lot of limitations and it is discussed many times by the District Child Protection Unit and the Child Welfare Committee on the strength of the method. However, we went forward with the realization that most of the children have a living parent or two who can take care of the children with or without support. Intensive monitoring of the children and families are conducted systematically on the lines of health, nutrition, education, and child protection. Since our presence is there in the community, we also sought the support of animators and volunteers who could provide genuine picture of the families. We conducted risk assessments, placement plan assessments for all the children who went back to the families. The results of the assessments, regular monitoring, and interaction and observation of children who can be reintegrated as or submitted to CWC and DCPU for taking decisions. The systematic case management procedure also aims at implementing active family support model by providing the immediate and long-term support for each family. I am happy at this time to inform you all that we do have children growing and living in families with much happiness and joy to share as our successfully reintegrated children. We have the picture of two families and children. So Kathy was a child of a mother who lost her husband. Kathy and her brother Bilevin were living in poverty and they were suffering a lot. So Cornerstone, learning the story, accepted all three, the two children and the mother, to live under the care of Cornerstone. Last year, after learning about the integration process and all the methods, we helped Catherine with her own interest to live with her mother. And Cornerstone had an opportunity to study the progress that this child made living with her own mother. Then this year, we allowed her brother also to go back and live with her mother in the family. During the pandemic, we gave relief support and considering all the 5 well-being domains, we supported in all their needs. So the my mother really says, I am not alone now. I have my own children to live with me, to share all my joys and sorrows. And I thank Cornerstone and Miracle Foundation for helping me and my children and to manage all my family needs. Another one successful story, a child and a mother, a widowed mother. So Kamal and Kamala is a widow. So both were struggling to lead their life as she lost her husband who died of heart attack. So Cornerstone accepted this boy Kamal and Mrs. Kamala to live under the care of Cornerstone. And in the beginning, she was not at all happy to take this child back to live with her. But then once she understood the real surprise and the things that son and mother are going to enjoy. She happily accepted the boy and now they are happy. So the mother says, Kamala says, even my own family members and relations never even thought of giving a helping hand when I was struggling with my son during the COVID-19 lockdown. But came forward by the miracle support, relief aid, and the stabilization package is the big help for us. She is sincerely thanking Cornerstone and Miracle Foundation for all its supports. So these are the experiences after running the children's home for more than 18 years, now moving towards family-based care or the safe permanent child integration. We are happy to go ahead as long as we integrate all other children at the best interest of them and that of the family. Thank you very much.
Thank you, Isaac. This was, really encouraging, and I really appreciate your commitment towards family-based care. And as you gave us the purview, some of the things, how which came out of what you said was really about the engagement with the CWC and the DCPU, which was a very important piece, and it took you time to do that. Also, you spoke about the structures in the community, like because the VCPCs, the farmers group, and then especially this whole perspective of now with the COVID, how the remote care is being provided to the children. And you spoke about the impact on the families and the whole purview of, how one has to look at child rights and child protection during COVID. And that is why, I am linking here this point with our next panelist, Prabhat, where, Save the Children did this survey during COVID on as to what is the impact on child protection. And really, we would like to hear from you as to, particularly in terms of the recommendations and what came out of it, because protection and well-being of children while they are in the families has also been a matter of concern, and people are careful about it. So that, and also how do you, as part of this survey, what can be done with the community structures in order to ensure child safeguarding and well-being? So if you could bring in that perspective also, so if you could talk about the survey and the findings.
Thank you, Rija. So, yeah, very briefly, I'll just talk about this was a rapid need assessment that we did conduct in June, and post that we have done another round, but we have not analyzed the report yet. So we covered largely 15 states with roughly around 7,200 respondents. So can you go to next slide, please? Next slide. Again, next. So what we, so I'll briefly be talking about, linking it to today's subject. Say, well-being of children is mostly dependent on the well-being of families and the caregivers. And considering that when we conducted this survey, we had to understand what are hardships of household, where the well-being of children might be impacted, because these are households from where either children move to CCAs or children move to vulnerabilities, or these are households where children are likely to come back. So when we spoke about what are the top 3 challenges that families have due to Corona, so roughly around 80% of the families responded that lack or limited cash for day-to-day expenses is challenge, which means 4 in 5 families tell that. Lack of livelihood option again was like 3 in 4 families, roughly 74% of the families said that. And lack of sufficient food and supply was something which was 50%, which means roughly half of the families don't have sufficient food. So we compared this with like the initial phase when there was strict lockdown, and then later on phase, except for lack of food supplies, other Other challenges were actually worsening, like the requirement of cash, the livelihood opportunities, those were worsening across both rural and urban areas. Then one of the questions that we asked was, what is hardship of household and how are you meeting your family needs now? And there was already report of they were making hard choices like through the saving, and we know that if past saving is being used later on, the coping mechanisms become much harder. So around 77% of families responded to that. There were already high incidence of families who were taking credit, mortgage, or loan. So it was 45%, and it was slightly high in urban areas where it was 56%. And then the through support received from government was just like 1 in 5 people said that they have been receiving support from government. This was again what we found out in June. Education was again a big challenge, and roughly around 42% of caregivers have said that they have not received any support from like school or teacher or any learning material or school-based support. So which was again a big thing. Nearly 3 out of 10 household reported that online session or guidance was provided by teacher. So which was again very less number. When we asked about the ways children spend their time was again, you will see like children, more than half of children said that they are learning on their own, so they have not been able to like go to peer or have that support. So related to child protection, we had just asked, and this was question that we asked to parents, that what are three most important concerns that you have about children? And they said that one of the biggest concern that they had was there, of course, because this was time when the fear of COVID-19 infection was high. So roughly 81% of caregivers said that, but rest too were also very important. Around 40% of them said that they are not able to provide adequate meal to children, and that is fear that children are suffering. And second was again around 67% of households said that being out of school and lack of learning at home, because they fear that these children might miss out on schooling, and so that figure that is there. Lastly, and this is a detailed report, so I'm just covering what would be immediately important to today's context. So what is the impact of COVID-19 and what changes that you are seeing that you will not be able to repair? So roughly 80% said that loss of work or job or income related opportunities. Again, the bar that you see in red, can you go to slide 9, please? Uh, so there 62% of the households said that discontinuation of children education was reported. So they are likely to be out of school because they have not been continuing their school. So from all these findings, some of the things the children and with organizations like-minded organizations, we gave a big push because that there should be more livelihood opportunities, cash inflows. So maybe provision of direct benefit transfer, cash transfer, the public distribution system, more and more people getting the access to rural guarantee scheme and other social protection schemes. So this is what we had prioritized, and had there was like some positive outcome based on that. Though, like I said, between April and June, we had seen the food stock availability had increased marginally. But we continued to provide food kit distribution, especially in urban area where there was lack of relief or proper PDS supplies or improved livelihood opportunities were not there. We also pushed for Anganwadis and schools were not open, so the midday meal and take-home rations, those eligible children or ladies who were women who were supposed to be provided, that how that can be continued, and we had worked with some of the government departments to make sure that they get access to this. One of the positive thing of this survey was there was almost half of households who said they were aware about the childline services or childline, and they so this is again, which means roughly half were not aware, so we made that awareness so that they at least knew one number where if child is facing any problem, they could get support from, or at least seek information from. So lastly, I want to give one disclaimer that this study did not capture any information on degree of protective factors like parental resilience or social connectiveness. But the situation that we have highlighted in this survey of the caregivers or parent or family clearly reflects that there is increased need to provide these supports to family or caregivers so that there is better ability to care. So with that, I end. Thank you, Rich.
Okay. Thank you, Prabhat. And also, anything, Prabhat, would you like to share about how this survey really helped save the children? If you could give some insight into, in terms of your response and preparedness towards your programs. So, any insights that you would like to share there?
So there were three things that we took from this survey. There were a number of other things, but three important things that I would want to highlight. One, we understood the need of food security and livelihood crisis, and how that impacts the well-being of children, not just directly, but also if parents start taking coping measures, which are like sending out children for labor or into exploitative work. So that is something we started pushing for more and more food security and livelihood related need. Mm-hmm. Second thing that we started using was taking help of the frontline providers like Anganwadi worker, the strengthening of village level child protection committees, so that they start linking people with different services so that the vulnerability of children is reduced. So frontline worker and strengthening of these community level committees, what we prioritize. And third thing we continued was, how do you continue the learning of children with the low cost or no cost method, not just online. So this was something where we did some pilot using different face-to-face measures. Even in some state, we started using loudspeakers, usage of community radio. So there were different approaches that we took up.
I see. Okay. All right. So, so far we've got these, a perspective about the processes, approaches, their practical application, and then the survey, which gives us a perspective into the situation which was found during the COVID. Now I'm coming to you, Gitanjali, where we are really looking at that how is the perspective of the government in terms of of course, when if I were to link it with what Prabhat just shared with us about the situation, especially aggravated of children during COVID. So in terms of when we talk about reintegration and safe and permanent reintegration of children, my question to you is how prepared do you think is the government and the state towards this, and also to look at how, mobilizing the community structures on the ground towards this, and the point which Prabhat made about the support, the preparedness and the attention that we need to prepare the caregivers and the parents. And I know that in Kerala, we've heard about the parent support centers, for setting up of parent support centers. So Gitanjali, if you could throw light on this, that will be very helpful.
Okay. Thank you.
I guess
Thank you,
you will be
Richa,
sharing
for
slides,
giving.
Gitanjali?
Yes, yes,
Okay.
yes, yes, yes.
All right.
Okay. Can you see the slides?
We can see the slide. Could you put it on
Okay.
full screen mode? Yeah, thank you.
Okay. I am very happy to hear the practices of child reintegration by various governmental and non-governmental organizations in India, especially Miracle Foundation. You are doing a great job in the area of reintegrating child to the family. With these practices, I am here presenting the preparedness of a state government, especially our Kerala government in the area of child reintegration and reintegration of child to their family. I think most of the practices explained here is in Kerala. It is all led by the state government. State government is doing all these activities like integrating child to the family, to the foster care systems, to the sponsorship, and all these have been initiated by the government. Here, the role of non-governmental organization when compared to government is very less in this area of child social reintegration according to Juvenile Justice Act 2015. The first slide, and just an introduction. The core of child protection, as we all know, is UNCRC, and the way for alternative care, we have UN alternative care guidelines and the JJ Act 2015. Then UN, from the UNCRC itself, the government, it is the responsibility of the state. It is the responsibility of the government. They have the responsibility for upbringing and development of the child, and it should be in the best interest of the child. Best interest of the child should be the primary concern of the government. Article 18 of UNCRC says, and Article 20 also says that if a child cannot be looked after their parents, the state has the responsibility to provide alternative care. The government following, as we all know that on the ground of this UNCRC, we have juvenile justice, a comprehensive act, a comprehensive law for the child, Juvenile Justice Act. This is followed in the state Kerala. This is followed by Kerala government. Kerala government, we have the responsibility for upbringing, the child upbringing and the development, and the government is responsible for providing alternative care for the child in need of care and protection. We are not saying that an orphan child or abandoned child. We are taking care of all the child in need of care and protection in the society. UN alternative guideline also says that efforts to keep children in or return them to the care of the family, or failing this, to find another appropriate and permanent solution. If the child is not keep in the family, we should find another appropriate and permanent solution. Here, the government is providing an appropriate and permanent solution for the child. The major state initiatives for the reintegration of the child are in the background. I have to share you some data regarding Kerala. There are 784 childcare institutions in Kerala. Among them, 27 are in government sector, and all others are in run by non-governmental organizations, religious institutions, and all. And when the lockdown declared by the government, around 16,980 children were in the CCIs, and out of more than 20,000 children in CCIs. Out of it, 16,980 children have been gone to their homes because of the pandemic, and around 5,000 children were in the CCIs. And in this situation, government had planned a very integrated approach, and and providing a permanent alternative care for these children. We have conducted, government have decided to those children in CCIs who are registered with the Juvenile Justice Act. Government have decided to admit the children to CCIs only with the support, only with the order of Child Welfare Committee. Child Welfare Committee have to decide whether the child should be taken into CCI or not, if she or he has a family or any other person in the family to look after the child. And we have conducted a comprehensive home study about these children in the country. The first and foremost thing is monitoring the admission to CCIs. The no child will be admitted to CCI without the order of Child Welfare Committee. This has been made mandatory, that without the order of Child Welfare Committee, no child will be admitted to child care institutions. An order of CWC has also been made mandatory for readmitting the children, those who have left to homes, and if they are coming, if they are readmitting the child to the child care institution, the CWC order made it mandatory. CWC should declare the child should be sent to CCI only on the basis of a home study conducted by Women and Child Development Department through our ICDS supervisors and CDPOs. ICDS supervisors conducting the home study of the children, those who are in the CCI. Then the home study is sent to DCPO, and the Women and Child Development Officer at the district level will recommend the child to the CWC for institutionalization. We are doing this process for the past 6 months. And it is very surprising that more than 30% of the percentage of the children who were sought admission to CCI, or who have applied to CWC for admission to CCI, we have given to those children who are economically backward. We have given sponsorship. We have ICPS is giving central and state government sponsorship, 2,000 rupees per child per month. We have converted them to sponsorship program, and the children have been placed in the home itself without admitting into the CCIs. And I think it is more than 100 children in the state have been the data is not accurate. I could not get the data from not from the state government, and more than 100 children have been placed to foster care, and especially in the kinship foster care, the children who do not have parent support, or parent were not there, they were sent to CCIs. And at that time, we have provided counseling to the parents, or siblings of the child's parents, and we have put them in kinship foster care, and also we supported them through sponsorship. We have given sponsorship to the children, and made the children, and we provided a family support for such children. And regarding foster care and adoption, it is purely managed by the state government. It is not. It is purely run by the state government, and district level it is the responsibility of District Child Protection Unit. And the state government, there is state adoption regulation agency is doing a great job here, and we are monitoring all these activities. I think up to 2020, 324 foster care has been given. We have given 161 in kinship foster care, and vacation in the homes. Children are going, 543 children have gone for a vacation foster care last year. And adoption, it is the data from 1990 onwards. 5,000 plus children have been given in adoption. It is also strictly monitored by the government in our state. And basically the community intervention, it is the it has been we have been doing in the field of child protection is child protection committee. It is the basic and the main responsible the main body behind the community interventions in the state. Child protection committee, it is as you all know, it is formed in the district level and block level and panchayat municipality level. It is formed. And here in Kerala, the Kerala Child Protection Commission, State Commission for the Protection of Child Rights, have taken a good initiative, and they have given a training, capacity building program for all the members of Child Protection Committee, and they have a clear idea of how to manage the issues of children in the committee. It was a great novel initiative by the Child Protection Commission in the state. And another main major intervention is local governments have earmarked 5% of their fund for the protection and development of the children. It is a compulsory. If the government have to approve their budget, they should earmark 5% of their fund for the development of children. And it is another major area of the child development is child-friendly local governance. It is an initiative from Kerala Institute of Local Administration, but all the elected representatives, all the LSGDs at municipality, district panchayat, block panchayat have been trained in child-friendly local governance. How it is purely based on the child and the four basic rights of the children. How to protect the development rights, how to protect protection rights, participation, and survival rights. They have prepared and a guideline on and each and every activity which should be done in each local self-government, and and they have also given certain criteria for assessing the performance of the local self-governments. It is a very noble initiative by the Kerala Institute of Local Administration, who have trained, and many programs have been initiated by state local panchayat and the municipalities. And the department is leading a vulnerability mapping from the Anganwadi center level onwards. Vulnerability mapping and the vulnerability criteria have been here in Kerala. We have a Master Shefi committee, and Master Shefi committee have been list out a criteria for a vulnerability, and each Anganwadi area is being mapped under this criteria, vulnerability mapping, and it is consolidated at the panchayat level by the ICD supervisor, and it's also been consolidated at a block level by the child development project officers, and it is consolidated at district level. The district has a vulnerability mapping data with the district, each district in Kerala, and we are planning the programs for the children. I think only this can. We are initiating many programs, and it is mainly it's a project. It's a project mode or a program mode. But if this program should have a sustainability, we should. So if we have to solve the issues of the children in a permanent manner, we should start from the community itself. It's a vulnerability mapping program done by the. Through this program, we can identify the child in need of care and protection who need it's really preventing the children from the abuse or any other vulnerable issues they have been faced. It is the main thing. And the following years, we are following this vulnerability mapping, and based on this, we are doing. I think in Kerala, we have faced many issues, and we have solution for that issues from the decentralization. As you all know, we have a model of Kerala model of development based on the local self-government. In the area of child protection also, child development also, we are putting the issues in the local self-governments. They are the responsible persons, and who the government very near to the children. very near your children is local self-government. They should know the issues of children, and the issues of children will be different from one panchayat to another, and the children in the municipal area will have a different sort of issues when compared to a panchayat, when compared to a municipal corporation. So the plan should be localized, and once the issues are localized, they have solution from the local body itself. We are following this, we are giving the whole responsibility to the local self government. I think we are sure that we can. From Kerala, we will develop a model of child protection with the help of this local self government. The community, if I think in our Sandhya madam's presentation, there is a question that political will is crucial. Yes, really political will is crucial. Anyway, today from no community have been owned the issues of children yet. From the social work principle, the community should own the issues of children. Community should feel that we have our children are facing such issues. Then only solution come from within the community.
Thank you.
We
Thank
are
you.
going to empower the social institution. Yes,
Yeah,
I
so
know. I
sorry
am
to,
with 2 minutes. I will.
yeah, yeah. I was saying that, yeah,
Am I audible?
yes, yes, you are audible. And thank you so much for giving us that perspective. Really got an insight on how particularly the government is looking at gatekeeping when you spoke about the earlier slides, and this whole issue of, like, integrating ICDS, bringing in and taking support, and where they are supporting the district child protection unit, and of course the local self-governments connect with the issues and their ownership, which is very, very important. And so we have a question also, we'll take it up on related to political will. But I would like to then move to Sharmila here, and in the interest of time. And so Sharmila here, let us talk about Gujarat and the work being done there towards when we look at this whole perspective of reintegration and safe and permanent reintegration of children. And also how the department is taking this, coordinating and building those synergies with other departments, the allocation of budgets towards this. So yeah, so give us a perspective of that.
Right. Thanks, Richa. I think the advantage of coming in last on a panel as committed and as experienced as the one that we have today is that there's a lot that I can skip already. I mean, 2 sessions I was thinking, okay, this has been covered, this has been covered, this has been covered. So that's great. I'm going to try and stick to the time that we have. I know we are also running a little bit late. So to start off, good afternoon, esteemed panelists and colleagues. I do not have a presentation. My laptop actually crashed just at 1 o'clock.
We got to know.
So it was a bit of a spiral, but I have taken down notes. So I'll be covering that. Apologies about not having a presentation. Thank you for sharing your learnings and experiences on this very critical issue within child protection, which is that of safe and permanent child reintegration. The specific topic that I will be focusing on, like Richa mentioned, is in Gujarat, the kind of convergence that has been sought and continues to be sought to be able to do meaningful reintegration of children. My first submission is that as a sector, as the child protection sector, and I'm sure we are already doing it, but I did want to make a highlight of it, is that our focus should be first on safe child integration. And if it does lie in the best interest of the child, then it can be permanent child reintegration too. But I think our focus primarily should always lie on the child's safety. One of our esteemed panelists did bring this previously as well during the presentation, as did Richa, that sometimes the home space and the community space also holds certain kinds of concerns for the child. So we should be mindful about where we are sending the child back and what kind of processes we are following, which then again highlights the issue of case management. And I was going through the Q&A actually during the sessions, and I saw that Junaid had brought up this question of in the importance of case management when we talk about child reintegration. Um, so I think, like I mentioned, the primary objective is the best interest of the child. Now, that's easier said than done. During COVID, as a precautionary measure, as well as in compliance with the Supreme Court writ order of April 3rd, I believe, children were sent back to their homes from various states, from all states. This was both for children in need of care and protection, as well as for children in conflict with the law. In my knowledge, at least in the country, we've never had at one time this kind of a wide-scaled sort of attempt and effort towards deinstitutionalization across the country. This has been a national effort. It has been in the response to a pandemic. Having said that, it has also been full of challenges as well as learnings. In Gujarat alone, out of about 4,500 children at any point of time, give or take 200, there are short-term children who come and go. There are, in terms of institutional care, there are about 4,300, 4,500 children on an average. Of that, about 2,400 children, of which 2,160 were children in need of care and protection, and about 43 children who were children in conflict with the law. They were sent back home. Now, I think it's important to also realize what that meant. That meant that all of a sudden, in a pandemic situation where functionaries, stakeholders, partners, government, organizations like yours and mine, we have additional roles and responsibilities in COVID response. We have our own family and personal stressors because of the uncertainties around a pandemic. We've never lived through a time like this. And then there are additional charges. And then there is the added complexity of doing remote case management. And deinstitutionalization at this scale. So I think the state, as well as partners and CSOs and generally the sector, was grappling with a lot at the time of such a wide scale movement back to their homes of children. So there has been in Gujarat, there has been intensive focus on capacity building and overall handholding support of district child protection units, of CWCs, of CCI staff, some of which have also been done with very close coordination with Miracle Foundation, which is a partner in Gujarat, and the Social Justice and Empowerment Department, which is the nodal department on child protection issues and handles the entire GJ mandate in the state. So there was an expedited case management format that was developed and shared with the department. It was done in coordination and with immense support from Miracle. This was shared with the department, and with some revisions, it was then consequently rolled out. A lot of the case management initially had to be done remotely. I believe some of it is still, I mean, there's still restrictions on movement. Some of it is still done remotely. And this basically means that the case management component, which is basically, again, handled by the CCI staff, the CWC staff, the DCPU team, have been in regular contact through with the families of children who returned through telephone, video calls, WhatsApp calls, etc. Within the circumstances, I think that's the best effort that one can make. If it's not possible to travel physically, it's not possible. But as an option B and a plan B, I think there's been intensive work in terms of doing remote case management. In one of the districts, and so basically when we were in discussions with the department and when we were in discussion with the Gujarat State Child Protection Society, what we also realized was that there would be need to bring in a convergence also at a district level to be able to then develop and gain greater insights and deeper insights into what lies beneath the best principle layer. So what that means, what are the last mile linkages, what kind of case management gaps are we finding, what kind of last mile linkages with social protection schemes we are finding, how effective is sponsorship, foster care, kinship care, how many children are we able to reach, are they able to apply, do they have the right paperwork? At the end of the day, these things matter. I mean, if the entire piece has to go forward, this entire linkage has to be done. So in Banaskantha, which is one of the tribal districts in Gujarat, UNICEF has partnered with a local CSO to further establish a demonstrable model on family-based care, which primarily focus, like I mentioned, on last mile linkages on the schemes and services. And this is done in collaboration and coordination with both the district administration as well as social justice and empowerment department. At the district level in Banaskantha, we are closely coordinating with the Department of Labor, with ICDS, with the Department of Education. We have started already discussing with Department of Health as well, so that when we do our home checks, when we do our first level of case management and talking to parents, also identifying vulnerable families that can be brought back into the fold of case management principles for social protection schemes. So this entire effort that we're doing in very close coordination with also with DALSA, with the district legal team, the services authority at Banaskantha. The focus basically is we're following different steps in being able to carry this entire piece out. The first is, of course, we have mapped out the different kinds of vulnerabilities with the kind of eligibility criteria that these different schemes have to be able to ensure that reintegration happens and retains. Second is based on this list of vulnerabilities and eligibility criteria, we're doing a situational analysis. How we are doing it is completely through coordination and convergence with different departments. So we are talking to our Anganwadi workers, we're talking to Talatis, we are in touch with the CBOs. Gujarat is a very strong community-based organizations, your Pani Samitis and Milk Samitis, Neem Samitis. So we're talking to those partners. Like we all know here, child protection functionaries, mostly at the sub-district level, is not as structured as a cadre as it is at the district level. Of course, we have child protection committees at the village level as well. But it's not a structured workforce cadre the way it is at the district level. So to be able to get down right at a household level in terms of a catchment area for a program, we're trying to ensure that we leverage as many networks at the block and the village level, at the Gram Panchayat level that we can, which is where all these other convergence areas come in. So we have done a first round of doing a situational analysis. And with the district administration pre-Diwali, just a week before Diwali, we started the process of facilitating linkages with Palak Mata Pita, with sponsorship, with foster care. The case management processes is something that we have also started vis-a-vis these linkages, along with identifying the gaps and strengths in the case management process. Actually, for this, we are using the expedited case management format, more or less broadly. And we're also sort of making a note of the gaps and strengths that exist in being able to complete the process. Now, since it's a CSO partner, we have dedicated workforce in mobilizing all of these networks of people that exist at the Gram Panchayat level with government support. But we're trying to understand that if it were to be done by the district level cadre with the CPCs at the block and the village level, how far would it have gone? What would have been the challenges? Because we want to feed this information back at the district and at the department level to then see how we strengthen the processes going forward. Because to be able to maintain best practice, I think first and foremost, beyond, of course, policy level changes and policy level revisions and fine tuning, what is absolutely necessary would be case management to ensure that the child is safe, that the child services continue, that the child is able to grow and develop in the household that is considered the best environment for the child. So as of now, we are at step 5, which is the entire linkage and gaps and strengths and case management. Once we have taken stock of it over the next 2 months, we are hoping by January end, we'll be able to feed it back to the district administration and social justice and empowerment department, like I said. The entire model is to look basically, like I mentioned, beneath the layers of what best practice, what the best principle, best interest principle entails for the child. What is it that one needs to do? Like how beneath the surface do we scratch to be able to manage this process and manage it meaningfully and safely for the child? And also, when we talk about these processes, of course, conceptually, I think as a sector, we are on broadly along similar understanding of the fact that it is absolutely imperative to be following these processes. But what does that entail in terms of resources, in terms of people, in terms of time, in terms of money, and do we have it? And if we don't have it, then who does it really? then those discussions need to start. I think that's the next stage of these discussions. While we advocate for changes at the state as well as at the national level, and state governments are also very committed to this, and they're trying. Everybody's trying. They're like ma'am before me from Kerala mentioned that a lot of the financial outlays go from the state level. It does even in Gujarat. As you would know, the foster care and sponsorship amount bursary is actually higher in Gujarat, and that goes from the state exchequer. So not to say that states are not doing their bit, but to also then complement ongoing efforts to say that this is the amount of resources, time, money, people that we require at all levels. And what that means in terms of department convergence, how can we do it? I think that's the next step. Again, there have been various pilots in different states. I know that I've worked, this is my third or fourth state that I'm sort of working this intensively in. But at scale, what kind of systemic changes do we then sort of try to bring forth? Also, this is again drawing from a previous discussion, both with the department as well as Miracle and our partners in Gujarat, is that when we talk about reintegration, this year has seen a lot. Again, like I mentioned, because of COVID, there was a wide scale sort of deinstitutionalization and children being sent back, and then subsequent linkages with different kinds of family retention schemes. Under ICPS, states have their own schemes. Rajasthan has the Palanhar scheme. Gujarat has Palak Mata Pita. So these are state-sponsored kinship care schemes. So under all of that, there are all of these linkages happening because we want to ensure that the child is retained in the family post-COVID as well. But just to also as a word of caution that when we undertake such a wide sort of an effort, there is a very high chance of children slipping through the cracks. If the case management is not strong enough, then we have sent the child back to the home. But is the child safe there? Do the services continue? Should deinstitutionalization and family reintegration at this stage become like a target to say 70% of the children need to be retained within the households and we have to do it? Is that something as a sector, as a system, all the people who are working with it through their different roles and scopes, is that something we'll be able to handle? That's a question I want to leave the panel as well as our participants with. And again, re-emphasize on the fact that till we get our case management right down the chain, like right from the state to the district to the catchment level, with our different functionaries and converging with your CPCs and Gram Sabhas and ICTs, Anganwadis, whichever CBOs, whatever local administration bodies we have at the local community level, till we manage to mobilize that, I think we would be there would be a lot of merit in sort of stepping cautiously into this area. I think I have.
Yeah. Okay. Yeah. Thank you so much, Sharmila. I think this example of Banaskantha, we really look forward to know more about that. I can see the whole design of it, really looking at, as you say, beneath the surface of the best interest and what does it really entail. So I think it will be a lot one can learn from it. As you said that, you'll be circling it back to the department. Right now, you're at the stage of looking at those gaps and case management and doing it. But certainly we would like to, I think we look forward to know more about it. But these are the kind of practices that, as you say, one has to reinforce. And glad to know that, the government could make use of the expedite case management tool. Miracle certainly would like to use our tools and processes as much as we can disseminate. Since we are running short of time, quickly, I would like to, I think a lot of questions coming in the chat, and I see question answers happening there. But let me go to some of the questions. And one of the questions which has been, which from our participants to all the panelists is about looking at the role of the Child Welfare Committee. So, what is it? So what do the panelists feel that is a very important role that Child Welfare Committee plays in the family-based care? I know during the session, the presentations, we have spoken about it, but other than that, if the panelists would like to point out to any significant point which they feel that has not been covered as far as the role of CWC is concerned. So any of the panelists would like to take it? Gitanjali ji or
Gitanjali, would you like to take up?
Yes, I think CWC is the main responsible authority for deciding the reintegration process of the children as per JJ Act. Then, if it's an NGO or a government institution, you can, I think, in case of an NGO, you can coordinate with the district child protection unit regarding the reintegration process of the children. CWC should, if CWC should decide or on a decide whether they should be kept in foster care or adoption. It is the CWC who have to declare a child as legally free for adoption, and CWC has to approve the foster care foster family if they are is an eligible family for foster care or not. As per JJ Act, it is the CWC should decide all the matters concerning the reintegration process of the children, and the district child protection unit should support CWC for taking appropriate decision. They should recommend CWC, then only CWC can decide whether the family or whether the type of reintegration is in the best interest of the child.
Yeah.
It is the main role should be done by the CWC. It is the legal authority.
I see. All right. If any other insight here, or we can move to another question. There is another question, I think, which is a very follow up is so important, as we say, in this entire process of reintegration of children when they have gone back to the family. So the question is, how do we address the concern on human resources and the government budget allocation? And also, so I think this is one, and the other is about how the community mindset and cultural norms can be handled. So these are, like, I think, very not a very straightforward answering questions, but complex questions. But any of the panelists, if you can dwell on some of these points, particularly when it comes to human resources, because if you look at the childcare institutions, or whether it is the DCPU or whether it is the CCI, there is a shortage of staff. And especially if we were to look at this sphere of following up with the family, following up with the children, how do you look at this, addressing this along with the budgetary allocation? So any insights, any thoughts there from the panelists?
Coming here, Richard.
Sorry, yeah, Sharmila, yeah. Please.
So I think vis-a-vis
Sharmila, your voice is very feeble. Yeah.
Can you hear me now?
Yeah, better.
Better?
Yeah.
So I think vis-a-vis the cultural norms, I just want to also give two positive examples here, which is that in both Rajasthan as well as Gujarat, I think the state kinship care scheme, I had briefly touched upon it also during my presentation. The state kinship care scheme, I think, has done a very interesting and very important thing. What they've done is they have basically harnessed the culture of community living. They don't let children, especially tribal communities and nomadic communities in Rajasthan and tribal communities even in Gujarat, they do not like the concept of children leaving their fold. So the government has very organically kept, like, what was already a practice is now being incentivized through money, because they wanted to encourage and promote this. And at Palanhar in Rajasthan has, I think, 2 lakh something number of children. I think this year it's increased because during COVID they went on a drive and increased the number of beneficiaries. Palak Mata Pita in Gujarat has about 16,500-ish. I don't know the exact number, but it's in that range. And I think they've done a very interesting job of taking an organic practice of community living, of not liking the fact that children will leave their fold and go to a city or go to a block or go to another institution altogether. And they have sort of turn that into a scheme. And I must also say that with Palanhar, and I remember quite a few discussions, I was working in Rajasthan before this, where the government said, look, of course, if there are any reports and if our monitoring reveals that the child needs to be sent to the CWC, we will get that entire process in. But these are organic community processes. Let's treat them as such. And I think that's worked to a large extent. As far as public knowledge around those are concerned, I think those have worked. And I think that's a very fantastic way of, turning a cultural practice and then incentivizing it and sort of giving a scheme on it. So I think that is something that I wanted to talk about when we spoke about the cultural bit. As far as HR goes, again, I touched upon it during my presentation. It's a pertinent point. HR and budgets. A lot of schemes hang on these at the end of the day. Whether or not and how much the commitment will go through depends on how much money and how many people we have and how much time we are willing to give. But also, I don't think that only having systemic structures to look at this would work, and it hasn't. Globally, there are always challenges. If the catchment area is the household and we have people at the province or a district level, there'll always be some slips and cracks. So it is definitely important to empower the community, and in doing that, talking to children to see what works for them. There have been so many rescued child labor children that we have spoken to in different homes, and a lot of them have actually said that no, this as a check and balance will not work because they are the ones who spoke to. So you know what I mean? Getting those insights is important, and I think empowering the community. And I believe the project that you are doing in Chota Udaipur as well, in terms of gatekeeping and empowering community members to do it, I think that will take us a long way. How much we're able to systemize that, of course, is a matter of time and how this evolves. But broadly, I think that's the way to go forward.
True, and that's no two ways about it, Sharmila. It's like I just
Richa, I would like to add one thing in addition to what Sharmila said about the staff redeployment, because we should not undermine the capacity and the skill what the NGOs have. So, or the childcare institution, if they are very much aligned with this movement of family-based care, so there is a possibility of redeployment of staff, and with have more power, obviously less burden on district, more on community. 100% agree what Sharmila said. Yeah.
Prabhat, any insights from you here, like high level, when you look at policy and then this issue of human resources?
So I would suggest just two things, and one is a very systemic way of training the human resources, particularly child protection workforce that we have. So one is that. Second is a slightly vision. I don't know from where we get resources. If we were to just say map all the structures of JJ Act and ICPS, I don't think we'll have many districts in India which would have all the human resources or structures that are required. So having that, and third important thing is the budget time is coming now, and it is, we have been saying increase the allocation. I think it's important to have that feasibility studies on what is your rationale, because if we say that the childcare institution has money, so much per child cost, or have what is cost that is required to make a district with all the child protection related workforce present. So that costing and feasibility budgeting exercise will be important, and we as a civil society should come together and advocate for that.
Thank you, Prabhat. And yes, we have exceeded 9 minutes, but I request the participants to bear with us. We're just almost in the last lap of the webinar. Okay. So basically, here I would like to also share with you the resources that Sandhya had pointed out. We have on the website of Miracle Foundation India, a child-centered case management toolkit is available there. And also for any support related to the processes, the approaches to family-based care, if you have any queries and any concerns and points that you would like to reach out and connect with us. So there is an email ID, safelyhome@miraclefoundation.org. These links are also provided in the chat box. And also I will request, there is a feedback survey link, which will be shared here in the chat box. I request all the participants to click on this. You can always fill it because at the moment you'll click on it, it'll take you to a different browser and you can fill it even after the webinar. But please do that. All right, so we are almost at the end of the webinar, and thank you so much to all the participants who've joined in and sharing your questions and thoughts with us. I really thank all our panelists to be here, and time is always a crunch, you know. So, but then even within that, we've been able to, you know, get a perspective and your purview on this entire issue of safe and permanent child reintegration. So thank you so much for taking out time to be here. And we will look forward to your coming in our future webinars as well. So yeah. And also kudos to the organizing team of this webinar led by Anjali Sood and Yamuna Menon, along with Sana, Kriti, Pem, Nilofer, and many more people in Miracle Foundation who contributed to this. So thank you so much for that. And just to share with you that we will also have a Hindi version of this webinar happening on 15th December, again a Tuesday, in the afternoon, same time, 3 p.m. to 4:30. And we request if you would like to share it in your network and you think that there are participants who will be really benefit from it, that will be great. We will have 2 new speakers joining in that day from Madhya Pradesh, the Joint Director from the Department of WCD, Dr. Sandhya Vyas, and Mr. Anup Kishore Sahai from Aramp will be joining. So and we also have a link here. I think a link will be shared in the chat for registration of this webinar. So, all right, I think that brings us to the end. And thank you so much. This was really exciting for us, for Miracle Foundation India, to host this webinar for the first time. And this is just the beginning. And we are so happy to be amongst all of you, which is like a community. And we are all together in this movement. And there is so much that has to be done. And with all the participants and panelists, I think to each one of us in Miracle Foundation India, it gives us the courage that, you know, we are all together in this. And even though, as the video said in the beginning, it looks impossible, but let us make it happen and seem it like a miracle. So thank you so much for being here, and we will again meet on 15th in the Hindi webinar.
Thank you.
So thank you so much.